My name is Sukharpreet Kaur and I am student of Sanika College. Today I am going to share learning outcomes of week 2, week 3 and week 4 of nursing informatics. So starting with week 2, we learn about nursing informatics, their importance in nursing practices and how it helps us to improve the quality of patient care. So nursing informatics is an science and practice that integrates nursing, its information and knowledge with communication technologies. So nurses should have to work in technological environments to give best outcomes, to give best care to the patients and to make proper decisions accordingly. One of the most fundamental reasons for nurses to focus on informatics is the advent of EHR, that is electronic health records. These electronic health records helps the nurses to have basic computer skills to work in day-to-day routines in nursing care practices, to work in administration and patient care. Nurses need to have need to know about all the documentations and patient precautions while using EHR. EHR makes easy for doctors and nurses to communicate effectively, and the most interpretation, the written and the verbal orders. Using these technologies, nurses can create and manage their lab reports, their x-rays and their previous history, and they also post latest update of the patients so that it can make easy for other medical personnels to match the history and the latest update accordingly. For instance, nurses EHR helps the nurses to record patient medications ordered by the physicians to avoid medication errors. They have the certain apps to manage patient medications. With this, the nurses not only avoid the medication errors, they also prevent the unintended drug interventions. Nursing informatics is highly linked with the patient care and patient safety. The potential to improve the patient safety exists through the use of medication, alerts, reminders, clinical flags, reporting of consultations and diagnostic testing, and the availability to complete the patient data. Stepping ahead towards week 3, stepping ahead towards week 3, the purpose of this week is to gain insight from the guidelines given by different organizations, which is CNA, that is Canadian Nursing Association, and CASN, that is Canadian Association of Schools of Nurses, to who ensures and maintains that nursing informatics field is up to date with the technological advancements. Nurses play vital roles as nursing informatics, nursing educators who are responsible for giving education, giving information to the healthcare workers to facilitate the ongoing education within the organization. CNAS guidelines promotes communication, increase capacity and engage by stakeholders. Their mission is positively impacting the health outcomes by advancing nursing informatics. These guidelines help the nurses to promote outcome of the patient's health, to promote their communication skills and to enhance their knowledge level. In week 4, the nursing objectives mainly focus on computer system that we use in our day-to-day life. The main parts of hardware of computer system, as well as internal and external components, which includes central processing unit, RAM, ROM, keyboard, CPU, motherboard, etc. We also learn about input, output, and storage devices. It is important for the nurses to know about all these computer skills, as it enables the nurses to quickly access the important information of patient, their illness, their health records, their history, uh, treatment plan from the electronic health records. Nurses can access such information such as lab reports, x-rays, and other health reports to give the best possible care to the patients or to the clients that are admitted in the hospitals or that are outpatient department clients. Nurses can access information electronically and make records. It is very helpful for the nurses to provide effective patient care. The knowledge of functions of computer are required to avoid basic errors during clinical practices. There are several ways to employ informatics uh, in future that helps to increase patient satisfaction as well as safety of patient. Like it helps nurses leaders to effectively communicate with the other medical personnel. Nurses no longer have to waste large chunks of their day trying to track down doctors or other clinicians. Nurses will have the ability and respect to make greater decisions in the care of their patients in the future.